Hi, I'm Allison Sobieski of PGS Network. I'm here again with Dr. Polyviou of Polyviou Family Dentistry. Dr. Polyviou, I know people come in when they have pain, but why is it important for patients to come in prior to having pain?
That's a really great question. So, in doing this in 21 years, the biggest problem we have with people when they have pain is they don't think straight. And they come in here and they always want the tooth pulled, which is not always the best decision. What we would like people to do is come in well before that because we can treat their problems in a very easy manner, no pain. We get to conserve a lot of tooth structure. So, for example, we have this patient here, and when this patient came into the office, we were reading his x-rays and he had some cavities in between his teeth that we can only read with digital x-rays, not the real small ones that you get, the analog x-rays. So it was difficult for this patient to trust us because it was a new patient and he didn't know us. So basically we let him know that he had a cavity here, and you can see there's some gray spots here. And there's no pain associated with this at all. So what I did is when the patient came into the office, I prepped the tooth, and as you can see here, look at how big these cavities were that were in his mouth. So if you can imagine, the patient saw this and was very happy that we were able to take care of these painlessly and preserve all this tooth structure for him.
Wow, it really is what I can only say to that. But so, if you hadn't seen this patient and didn't start this and go through this with them, and they didn't trust you and believe you that you indeed had cavities, what could have happened?
Well, ultimately, what would have happened was these cavities would have gone into the nerve. And then once it goes into the nerve, now the patient comes in with an abscess, swelling, severe pain, can't sleep. Their quality of life is ruined. So what they do is they call an emergency basis, and now they're thinking with an emergency head, and their first thought process is, let's get this tooth out. The problem is to save this tooth now, we'd have to perform a root canal on this tooth, and now it's about $1,200 or $1,400 to save this tooth, and then another couple $100 to put the filling in this tooth, and there's less tooth structure. So would this tooth last them their whole life? Maybe not, because now there's more filling than tooth at this point.
Well, so you've also just saved them from pain in their mouth, but also pain in their pocket, right?
Correct. So that's a big deal.
So you can become a patient here. You don't want to wait until you're in pain. Tell us about your new patient specials.
So our new patient specials are, we have one for a $35 fee. You get a full set of x-rays and an exam by the doctor and an oral cancer exam, all included in that. And the other way to come in is a lot of people want these exams, but they also want their cleaning the same day because their work schedule is difficult and they want to, it's more efficient for them. So we have a $99 special that includes the exam, the oral cancer exam, the full set of x-rays, and then the cleaning the same day.
For more information on how you can come and see Dr. Polyviou and his staff here, you can visit everyonesmiles.com or call the office to schedule your appointment.